1.
Greetings. The Black Coalition for Safe Motherhood welcomes you to Worthy of Respect and Dignified Care, Your Rights During Pregnancy and Childbirth. We'll wait a few minutes as participants begin to join, but please feel free to share your name and location in the chat as you enter. Thank you again for joining Worthy of Respect and Dignified Care, Your Rights During Pregnancy and Birth. The Black Coalition for Safe Motherhood is honored to be here with you today for its first ever event and to help launch the 4th annual National Black Maternal Health Week. My name is Nubia Earth Martin. I'm a board member of the Black Coalition for Safe Motherhood and the president and founder of Birth from the Earth, Inc. It's my pleasure to host today's event on behalf of the Black Coalition for Safe Motherhood. BCFSM is a nonprofit organization established by a group of committed birth justice activists that seek to improve Black maternal health through promotion of healthcare advocacy and holistic community support of birthing people. BCFSM is proud to promote the ACT curriculum, which has been created by Black women for Black birthing people. ACT is a set of steps that are self-affirming and potentially life-saving. ACT is an acronym that stands for A, ask questions until you understand the answers. C, claim your space, both physical and mental. T, trust your body. And the last T, tell your story. Today's conversation will focus on how Black people can claim ownership of their health and well-being, centering the pregnancy and birth that they deserve. Our intention today is to spend most of our time talking through solutions to the maternal health crisis in the United States and to share the vision of how we can shift the narrative and move in that direction. BCFSM is proud to bring you this event with the support of our sponsors, Sage Therapeutics, Tailor-Made Fragrances, and Rhea Ventures. We would also like to take time to thank Matt Hughes and the Roosevelt Institute for kindly permitting us to use their webinar platform for today's event. And now we're in for a treat. We're thrilled to be able to share a performance by Tony and Obie Award-winning playwright and actress, Sarah Jones. Sarah is known for the multi-character one-person Broadway hit, Bridge and Tunnel, and her current critically acclaimed show, Sell by Date. Sarah has performed for audiences around the world, and she's raised awareness on issues including ethnic, racial, and economic inequalities or inequities in the United States. As the child of 2 doctors, including our own Leslie Farrington, everything she does is rooted in hope for healing. You're about to learn that Sarah depicts personalities from a variety of different backgrounds, all based on people from her real life. So we don't know who you're about to meet, but we'll just say, welcome Sarah and her friends.
Hello, everyone. And thank you, Nubia, so much for that introduction. Thanks as well to BCFSM for having me, and of course, all the wonderful panelists here in honor of Black Maternal Health Week in the US. Now, I know you're probably listening to my accent and you're like, wait a minute, what? But I'm actually here to remind people that the Black diaspora, including in the UK, where Black mums are 5 times more likely to die because of pregnancy complications. We even have an organization by that name, 5 times, right? So all of us as Black birthing people all over the world are being helped by this work you're doing. And so in the spirit of the expertise and the authentic voices of all the panelists who you're going to get to hear today, I wanted to let you know that I don't actually talk like this. I do speak the Queen's English. I'm from Queens, New York. But I wanted to be here to celebrate with you and to let a few other voices speak as well. So, hi everybody. My name is Keisha. I'm so excited to be here with y'all. I'm nervous. And I told Sarah Jones I don't really like speaking in public, and I also hate Zoom. But for y'all, I wanted to be here, even though I'm really not like no medical expert or nothing like that. But she said all I have to do is come here, share my experience. I am a new mother. And like with my daughter, so y'all will understand this. I had planned to have a vaginal delivery at the hospital and do skin to skin immediately after giving birth, like my doula taught me. My partner Jerome was with me. I was trying to make optimum conditions because I read all the books, y'all, all the books. But we didn't realize I wasn't prepared that I was going to end up in labor for over 24 hours. Yeah, I was done after like 24 minutes. So it was like really, on top of that, the baby was in distress. And at a certain point, I just broke on the medical staff. I got to be honest, because first of all, they was just disrespectful the whole time I was there. My pain levels, they wasn't taking me seriously. This one white nurse, she thought she had jokes. She was like, oh, this should be a breeze for you with all those tattoos and piercings. I want to be like, bitch, ain't no, excuse me. The point is, I know y'all know what it is. You know, it's hard enough. They didn't want me to have my doula with me. My partner Jerome, he was going through it. It just, childbirth is hard enough. And then we had to deal with this racist ass system. So I just want to say, I know the whole point of today, we trying to change all this. We trying to stay hopeful. And actually, I do want to mention one little bright spot. I started to say white spot. Y'all gonna know why that's funny. But it was this one white nurse at the hospital who kept trying to have my back. And I wanted to let her speak for just a hot second. Linda? Thanks, Keisha. I have to say I really hesitated to be here today. As a person with white privilege, I just feel like every second that I'm speaking here is just more white spreading into your panel. But I do want to affirm that when it comes to medical racism, this is something that's just it's not taught in schools. I mean, white practitioners like the racism that's already in society and then medical racism, it breaks my heart as a registered nurse. I know what the disparities in the lives of Black mothers and babies look like, how they're treated compared to their white counterparts in private hospitals. And so I'm just grateful for all you're doing, and I'm going to be quiet and listen and learn. And I hope more white people will do the same. Thanks for that, Linda. Hi everybody. I wanted to chime in myself as well. My name is Rosali. I'm a doula. I'm also a Black woman, and as an Afro Latina, I'm half Dominican, half Puerto Rican, all proud. I am so passionate about birth justice, reproductive rights, not only because first of all, being a doula ain't just rebosos and hip squeezes, you know what I'm saying? It's advocacy too. And a lot of us, we learned this because we had to self-advocate, as many of the panelists can attest. So I just want to say, whether we're here, speaking all of the like critical race theory that we all learned how to talk about in school, or whether we got to like keep it real, keep it very passionate and go hard for our clients. Like for me, dealing with Keisha, it reminded me that the whole reason I got into this in the first place was, my firstborn. When I was 17 years old, there was no advocacy for Black mamas. So I'm just glad to be here. I'm honored. And with that, let's let the panel begin.
Thank you so much, Sarah Jones, for that powerful performance. Please feel free to share your reactions in the chat, and we'll hear more from Sarah later on in the program. Now, I'd like to move us on to the panel discussion, and I kindly ask our moderator, Taja Lindley, to join us and to take over.
Peace, everyone. Hi, welcome. My name is Taja Lindley. I use she, her pronouns. I'm an artist as well as the creator and host of the Justice Podcast NYC. This podcast takes a close, comprehensive, and creative look at how folks in New York City experience and navigate reproductive oppression and create resilient strategies for their health and for their families. Through storytelling and conversations, the Birth Justice Podcast provides a space for dialogue and debate, addressing one of New York City's most pressing public health and racial justice issues, birth. And a couple of the episodes feature panelists that you're going to hear from today. So I want to kindly ask the panelists to start their videos. I'm going to share a little bit about them and they're going to say hello. So thank you to our esteemed panelists. We already know our amazing host, Nubia Earth Martin, and I'm now going to ask each of our remaining panelists to say a quick hello. And if you would like to know more about them, their biographies are going to be in the chat. So just a quick round before folks say hello. We've got Carmen Mojica, founder of These Waters Run Deep and co-founder of BX Rebirth and Progress Collective. We also got Nicole JeanBaptiste, full spectrum doula with Sésé Doula Services, and also the co-founder of BX Rebirth and Progress Collective. And Mama Shafia Monroe, we say Mama for a reason, that is respect and honor. She is the founder and owner of Shafia Monroe Consulting and is also Queen Mother of the Midwife Movement. So if folks can come on off of mute and say hello so we can hear your voices.
Hi, everybody. Thank you for having me.
Hi, everyone. Thank you for being here. It is an honor.
I want to say Assalamu alaikum, hola, nihoma, bonjour, what's up? Glad to be with you all.
All right, so we want the discussion to be interactive. If you have comments, use the chat. If you have questions, please use the Q&A function. So we saw earlier about the ACT curriculum. BCFSM is sharing ACT, ACTT curriculum throughout the country, teaching Black birthing people to ask questions until you understand the answers, claim your space, trust your body, and tell your story. So I'm going to invite each of the panelists to share a story that illuminates the importance of ACT. Specifically, how have these principles worked or not worked in practice? And we're going to begin with Nicole with Ask Questions.
Thank you, Taja. Yeah, I'm really happy that I was assigned this part of the acronym. Ask questions until you understand the answers. And that's because the second part of this principle is so important, because too often our questions are met with responses that are masked as thorough answers, when in actuality, they are dismissals of our concerns, right? So from a provider, this sometimes sounds like, oh, that pain or discomfort is common during pregnancy. Don't worry about it, with no explanation as to why it's common, not to be confused with normal and safe. And, you know, I learned firsthand the value in making it a practice to ask questions repeatedly until you are fully understanding what it is, the response you're given. Right. So with my first pregnancy, I was really excited to experience labor that was unmedicated up until, I want to say maybe it was week 36, very close to my estimated due date. I was told by my provider that I had to schedule a C-section. And so I'm shocked, I'm disappointed. And I asked why, right? So the response I got was not one that I understood. It was this: I had to have a C-section because of my baby's presentation as breech. And I'm thinking about it, you know, okay, I understand breech, baby's head is facing up, bottom is facing down. And I know this because my mother had the same experience with my oldest sister, right? And I really didn't understand this. Because of that, I know that my mom did this. Like, why is it that I can't do this still unmedicated, right? So didn't really understand. And there were also no other indications as to why I would need to have a birth that was, surgical at the end of the day, right? I had just turned 20, I was healthy, I was active, baby was doing well. So, now I'm really, really confused. I felt like I had no other option though, because at the time I was of the belief that, what the doctor says goes. Never mind my intuition, never mind, stories that had been passed down to me within my family about this very same occurrence and it being done unmedicated and safely with the support of skilled providers, right? So this would have been a situation where had I asked more questions to gain understanding as to why this needed to happen, I could have gotten to the bottom of or been informed about that, people we're not incapable of birthing this way. What's actually the case today is that providers are not being trained to support birth in this way. So had I dug, perhaps I would have gotten to that piece of information from my provider. I also would have been informed that I had options around encouraging my baby to change position, and those were not things that were shared with me. And wholehearted, 100%, I should have been given that information, whether or not I asked more questions.
Thank you, Nicole. Thank you for sharing your story. Claim your space, Carmen.
So thank you. I want to preface this by saying that most of the births that I have seen in my career have been out of hospital. So getting this one is actually something that's the norm for me to see this in action. And what came to mind is I did my training as a midwife at a birth center in El Paso, Texas. And I remember I was super duper duper baby midwife, probably hadn't even called a midwife at this point. Baby, excuse me. And the mom comes in, she's a multip, like she's like quietly going through her contractions, and I'm witnessing and watching her go through this, and you could just feel this like her emanating her space into the room to the point where like it was her and her partner. I think it was like baby 4 or 5, and you can just feel like they were like, this is where we're at, we don't need y'all to come in. And so the staff midwife and me, we were almost like repelled, and not in a bad way, but just like okay, like this woman is walking in and just creating literally a space. They put a candle, they had music, like they didn't even, there was no discussion, they just walked in and created the space. So much to the point that the only time that we went in to see her was because, and this was actually my first catch, the only reason that we went in to go see her is because we're speaking and we're talking at the table and we hear the proverbial bearing down sound. And I can't tell you how quick we ran to make sure that this baby didn't, land on the floor because she was standing upright. And it was like, wow, like the only time that we entered that space is when she allowed us to, because she had, without any words, with just her presence, so quietly claimed her space. I'm like, I feel that that is possible when you're in a birthing space such as your home, or a birthing center that is able to provide you that space that so often is not available, that we do so much negotiating to have that mental space and that physical space respected and honored.
Thank you, Carmen, and thank you for bringing in the sacredness of birth. Mama Shafia, trust your body. What's your story?
I'm going to give you 4 quick stories. So, first one, I want to go from pregnancy to postpartum. Pregnancy, I got pregnant. I know my body. I went and had my test. It came back negative. I went to the hospital for my pregnancy test. It came back negative. I knew I was pregnant. I tried to say that I wasn't, take some medication. I refused. Went back later. I was pregnant. So I trusted my body. My baby, my fourth baby, I have 7 children. One of my babies was sick one time. I'm breastfeeding, but she's not acting right. So I keep bringing to the pediatrician, said, there's something wrong. There's something wrong. They kept saying, no, there isn't. No, there is. I say, yes, there is. I kept going every day. Finally, I found out she had pneumonia. She was 3 months old. So trust your body means you also trust your parenting. Postpartum, pregnancy, my water broke 3 days before I had my baby. And so it was like, go to the hospital. Your water broke past 12 hours, past 24 hours. Like, you know what? I got this. I'm going to be okay. Home birth, no problem. 3 days of I'm not recommending that for other people, but I trusted my body to do that. Postpartum, on my first baby, second baby, I had a really bad tear. As I went to my midwife said, I got a hematoma, like a blood clot that keeps the skin all open, like a 2nd degree, something like that. So I go see the OB. She's like, oh yeah, we got to sew you up. You got to come back and you can't bring your baby. And I'm like, well, if I can't bring my baby, I'm not going to come back. So I trusted my body by sitting in comfort and ginger for 19 days. When I went back on my 6-week checkup, she's like, wow, I would have not ever thought you had a tear. Like there's no sign of scar tissue, nothing. So trusting my body, knowing that I was pregnant, trusting my body that I knew my baby was sick, trusting my body, knowing that I could have my baby, though my water had ruptured 3 days prior to the birth. And then lastly, postpartum, trusting my body that I knew I could heal. So that's such an important point. And I think we've learned over the years, I'm a lot older than you all. Obviously, my oldest child is 42. You can do the math if you want to. But so I've seen a lot. And I know that the generations we've gotten further along, there's less trust. We've become a lot more, the ultrasound said my baby's too small. What do you think your baby is? I'm going to be induced. Well, don't go to the hospital. I'm going to be induced on Friday. Right. Wait for me to show up because I'm not. So you got to trust your body and believe that you know more than the doctor. They're trained to assist you, not dictate to you. So that's my message on trust. I love that topic.
Yes. And shout out to you breaking down 4 stories and unprecedented amount of time. Yes. Thank you so much.
Thank you.
All right. Nubia, tell your story.
Yeah, so I'm just grateful to be here, one with everybody. But this part of the acronym, I think, is one of my favorites. I love all of them, but I have to say, tell your story is so important because that's part of who we are as, people of the African diaspora. We've always had oral tradition as part of our history, the ancient art of storytelling, passing things down. That's, how the grand midwives pass down their, herbal wisdom, their knowledge, their skills from generation to generation. So for me, tell your story is pretty much how I got started in birth work. I had my first 2 children in hospital setting and then went on to have 3 amazing births. But it wasn't until I started sharing those 2 birth experiences that I realized some of the biases that I experienced were not uncommon. I thought this was just unique to me. For most people who know my second birth story in the hospital, they brought me the wrong baby to breastfeed. So all of these things, sharing that and finding that these were actually common occurrences made me realize that there has to be another way. And that's what ultimately set me on my path to becoming a childbirth educator and then a labor support person and eventually a midwife. But I encourage people to tell their stories and to share them because we need to not only hear the horror stories, we also need to hear the positive stories because there are many out there. I'm witness to it. I know Nicole, Mama Shafia, Carmen, all of us on this panel are witness to the beautiful stories and how powerful that is when you share that message with somebody and when you watch a family be able to kind of reiterate what they experienced in their own words without giving them a script, but just allowing them to express that. It's incredibly powerful and beautiful. So I love all of the acronyms, but I have to say the Tell Your Story one is one of my favorites. Thank you.
Thank you, Nubia. And wow. Thank you all for sharing those stories. Really powerful, important. And I know in this panel, we really want to talk about like, what's the way forward and what are we working towards? So thank you, Nubia, for mentioning, like, we got to tell the stories of what's working and what's the vision, as well as the things that are the problem. This panel is centering respectful and dignified care. What exactly does dignified and respectful care look like for Black birthing people who birth at home, in a hospital, or at a birthing center? And any of you can pick that up.
I'll start if nobody else wants to. So similar to Carmen, most of my birth experiences have been out of hospital setting, and that's been intentional. But during my midwifery training, all of my clinicals were in a hospital setting. So what I really wanted to be able to maintain for those who were birthing within a medical industrial complex was, this is your body, this is your birth, this is your baby. At the end of the day, you have a say so in how this evolves. And, initially I got a lot of pushback from my preceptors. Oh, get in there and tell her this. Oh, get in there. That whole get your hands in there. And I was like, no, I trust her body and I'm going to allow her to birth. And they were astounded that for all the moms who I supported, none of them chose to have pain medication or an epidural, and none of them had any tears. And that was because I kept my hands to myself. And I trusted that they didn't need help to birth their baby, that I was simply just catching their baby. They were delivering their babies. When I finished midwifery school, I think I realized that, in my opinion, if somebody is, healthy, having a quote unquote low risk pregnancy, and they desire to birth at home, that I want to support that, because when you're in your home environment, you feel, more at ease. You're on your own turf. You're not going to have people coming in that you've never seen your whole, pregnancy. You're not on a time clock. And I'm really just honored to be in their space, that they're allowing me the honor to be present for them. So for me, I've seen that and other out of hospital settings be the most dignified space. But I do also want people to understand that any space that you're going to birth in, you can create and make your own. So I think we need to, not shame somebody if they want to birth at a hospital, but we need to also help them find the best hospital in their area. The hospital that perhaps has midwives on staff, the hospital that has lower C-section rates and is going to honor things like VBAC. And similar to what Nicole was saying earlier about breech birth and twins, and the fact that these are hand skills that are becoming lost, and that's what's driving up our C-section rates. We need more providers that are not afraid and are not practicing out of fear. And I went to an amazing workshop a couple of years ago called Breech Without Borders, and was able to, acquire those skills. And I've caught many breech babies. I've been present for many twin home births, and I know that's not the norm. But if somebody feels empowered to want to do that in their home setting, then we need to also have, the proper supply to meet up with demand of people becoming more conscious about, this is just a variation of normal, and this is what is going to make me feel whole and dignified to bring my baby forth this way, no matter what position they're in, other than transverse, obviously, but no matter what position they're in, and even if it's multiples.
If I may hop in here with this dignified and respectful birth. So majority of the births I've seen have been actually in a birth center through training, and now where I am at. And I've also seen home birth. And so I think first, I feel that like having the option of birth center is part of this dignified and respectful care in childbirth discussion, because while we all have our own personal beliefs about where folks should birth, all the folks, at least in the capacity that I've met on this panel, believe hands down that we all just need options, period. And you deserve to give birth where you want to give birth. So that's why I'm such a birth center advocate. With that said, birth center advocacy doesn't come without its critique, and the critique being of the way to achieve this is to make sure that the staff is not repeating the similar patterns as in hospital settings. The way that I've seen it happen, especially like right now during COVID, have seen a lot of Black and Latina individuals coming into the birth center to give birth, and for them, I feel that I have seen the dignity and the respect be respected across the board at the births that I've been able to go to. Not only in the care given, but also like just the fact that the space itself offers a sigh of relief. And I think that like speaking about like fear and how you lose your dignity, right, in fear, and that you can't access your wisdom, and you can't, and then you go into a place of trauma. Being able to have providers in place that can not just see what's going on in your body, but can like see that fear, can see that you're coming up against something, right? And Mama Shafia, you mentioned like this knowing, right? And moving away from the knowing and moving towards machines. I think that the way that I've seen this dignity happen, even in a birth setting, is moving away from the machine and like being able to like notice this is coming up, or I can read this in the room, or I remember I was with a fellow Black midwife and there was a birth going on, something was happening in the labor, and me and her looked at each other kind of like, she was West Indian, so we made like the proverbial tongue click sound that we all make, like, and then we literally moved energy right in the room, because to be able to respect in birth is so much about respecting the body, but also respecting the spirit, right? Respecting the energy in the room. And so birth centers for me, because that's a happy medium that I feel we need, even the learning of moving that energy, right? As we're talking about dignity. And that's what I'll say about birth centers, Mom Shafia.
I just wanted to add that I agree with what both have said to date, but I want to remember the women, the Black women, the Black people who are considered high risk. And unfortunately, a lot of us do have predisposed problems. And I've learned, because we were born premature, when we talk about infant mortality and the premature rate, we now know that that premature person grows up with a lot of predisposed problems, which is why we need to really end premature birth in the Black community. But with that said, just because you're high risk and you're seeing a perinatalogist, that's no excuse for anyone to disrespect you. You're still a human being. It's still your baby. You still need to advocate for yourself, and whether it's a home birth or a birth center, because you have to birth in a hospital, you still should have dignified care. And that means maybe making sure you for sure that you have a doula, making sure you interviewed your perinatalist. I don't call it the birth plan, I call it the maternity care birth plan. Does it cover all of your needs: pregnancy, labor, birth, and postpartum? Interviewing, who they are. And if you want them, we are health consumers. We're paying for a service. So you decide, tell them, I want respectful care, even though I'm considered, having health problems. I just want to put that out there, that women or pregnant people who have a lot of things going on for them, they're getting a lot of tests, they have to go in much more often, they're on bed rest. There's already a lot of stress, and that system tends to rush them and see them as a sick object and not as an expecting person. So maintain the dignity, no matter what your health condition is. You're still having a baby. You need the exact same care and love and interaction, and your questions answered and all those kind of things.
Yeah, I'd have to agree with everyone here. I mean, I think, as the cornerstone of us seeing respectful and dignified care across the board, we have to start to see personhood being centered in these spaces. We are people, we are human beings, we've been terming what we've been seeing highlighted in the media over the past few years around the Black maternal health crisis, is that a Black maternal health crisis. And yes, that's what we're knowing it as, but it's also a human rights issue. You step into these spaces and your human rights are being violated. And I think at the core of that is because personhood is being decentered. We're being viewed as our chart. We are not the emotions, the range of emotions that we experience during labor are being overlooked, they're ignored, and there's so much emphasis on, okay, what's the machine saying? Oh no, you have to stay in bed because I'm not able to pick up the baby's fetal, the heart tones because the monitor is moving too much, with little to no regard for, what is happening within this person's mind, their body. So I think what needs to happen is centering people as human beings, the experience, the sacred experience of birth, and beginning to see providers strive toward achieving a better balance between working in the favor of the person who's birthing and their goals, their desires, their vision for the experience, and how to ensure that this happens safely. How to ensure that this happens without trauma, without harm to baby or birthing person. Oh, and that versus convenience of, the hospital policies or the birthing center policies and convenience for the provider. So yeah, centering personhood is the way to respectful and dignified care.
And also race, we have to be real that, if we know that white women or white birthing people are having better outcomes for the exact same maternal morbidity, maternal mortality problem, then we can say human people. That's correct, but we also have to take the elephant or look at the elephant in the room that you're seeing people who don't have white skin or considered African descent not worthy of having dignified care, and that's the historical trauma. And so I think that has to come to the conversation first. And I always tell my clients who are having a hospital birth, ask your care provider in the institution, are you aware of the systemic racism in your institution? Are you aware that Black women, people are having worse outcomes? And how can you guarantee to protect me from the systemic racism if I use you as my provider in this setting? And then just get quiet and see what they have to say. Let them say what they're getting paid for, how they're going to protect you, and bring out the fact that I'm aware that I'm a Black woman and I know what the issues are. Do you know, and how are you going to make sure that I'm safe?
Yeah, absolutely, to all of that. I'm curious about, to dig a little deeper into this question. We've talked a bit about the vision, but I know that sometimes there are barriers, even inside of the more ideal places or professions. So sometimes what I hear a lot is like, let's move more towards midwifery, let's move towards birth centers and home births. And we know for a number of different reasons, including like insurance coverage and people knowing or not knowing their options, that may not always be a viable option for folks, or they may not know that it's a viable option for them. And then we also hear stories of folks who encounter racism, disrespect, and undignified care, even inside of like the more ideal settings. And so I'm curious about like what is inside, like how and why do practices that happen inside of hospitals or inside of a obstetrics and gynecology practice get mirrored inside of these other spaces and professions, and what can be done to like move it more towards the sacredness of birth that you all were talking about?
I think that one solid example that I can think about, and what prevents this, at least birth sensors, and I can't speak for every single birth center in the United States, but I do know that many birth centers struggle with having physician-led birth centers versus midwife-led birth centers. Um, Although all midwives are not created equal, that's a really big jump in terms of like who has the ownership, who has the purse strings of that birth center. I think that when we're talking about racism, we need to talk about capitalism because they go hand in hand, right? And so while folks are saying, who's the racist in the room, I want to know who's the person who got the money in the room. Because especially here in the United States, like the reason why we have the type of churning out of labor, right? Both like maternal labor and then like the labor of people who are Black and indigenous and so on and so forth, because it produces money and it continues the business that was taken away and that we replaced, right? And so I say that to say that when what I've seen is that birth centers that have these challenging situations happen at them, um, it comes from the stem of who is moving that money and how that money moves through that location, right? And then I think the same even for hospitals. And I've said this in several meetings that I've been at when we're talking about birth justice, is like we can come up with all of these policies and procedures and implicit bias trainings and like cultural competency trainings, all the trainings that we all been to here in this room. And if the hospital is still making the same amount of money and the nurses are still making the same amount of money, and there is no accountability that's hitting the pocket of those institutions. And this is not by any means saying that like public hospitals should be less funded, because they're in the position that they're in because of the funding that they don't have. there needs to be a conversation around like who is going to be over the oversight of these institutions that are supposed to be different. And then what you see then happen is that if money is the concern, the providers act accordingly, because money can change many people's characters, or have their hand tied behind their back, right? It's not always necessarily their character, but then they feel like their hands are tied behind their back. It doesn't excuse the behavior by any means, but I think that like capitalism, I really feel like I want to make sure that we're having that as part of like racism's best friend, if you will.
Yeah, I everything that you just said, absolutely, because we have to, one, come to terms with and recognize that this country values profit over people, and that's been since its inception. So we have to be willing to kind of shake that up. And what's happening, and what we saw specifically, at the height of the pandemic, is more people wanting to explore out of hospital settings. And then once they've done their research and got a little bit of education and find out about their options, and then really falling in love with that idea, well, then the next barrier is, well, finances. Insurance doesn't cover it the same way, especially for home birth. So it's like you give somebody something that feels right for them, and then you say, oh, but you can't actually attain that. So that's one of the things that we've been working towards. And prior to the pandemic, creating an access to home birth scholarship, so that if somebody was an ideal candidate for home birth, they found a midwifery team that they want to work with, and for whatever reason their insurance is not going to cover the whole thing, that they can apply and get their out-of-pocket expenses covered, so that that's not a barrier, because that is literally the difference between life and death for some people, where they're going to give birth. And what's happening is people are really being drawn towards the true midwifery model of care, which is not looking at all those machines. It's what is the actual birthing person saying? What are they feeling? What are they experiencing? And working with them as an integral part of their own health and wellness, so that, yeah, maybe they start out the pregnancy with at a higher risk for, I don't know, anemia or gestational diabetes, but we work with them about their diet, about lifestyle changes. We explain to them what the significance is of going through a pregnancy being chronically anemic, and how that can complicate a pregnancy, so that they understand. And you're not just telling them, here, take this pill, or, oh, don't be anemic, but explaining to them the etiology behind that. And when we're talking about preterm birth, we have to talk about stress, and the stress that, as people of color and Black women, that just showing up in this world every day is stressful. And then you add on top of that, perhaps pregnancy, job insecurity, being the head of household, all these other stressors, and how that impacts us and impacts our babies and impacts the integrity of the placenta, and how that then, translates to a baby that's in there saying, well, I'm safer outside of my mom than inside my mom. And then we have preterm births, or preeclampsia, which is very prevalent. And then the quote unquote cure is get that baby out, even if it's a preterm baby. So we need to take some steps back, and, well, we can prevent preeclampsia. Preeclampsia is about severe malnutrition of 3 main nutrients. So you need to explain that to somebody early in pregnancy, so that they understand. And when physicians say, oh, well, if she had preeclampsia in a past pregnancy, she's probably going to get it again, I argue, well, yes, if she hasn't made any changes to her diet, if she's still, of course, but that is preventable. And if we're talking again about centering people, and I'm going to say specifically Black people and people of African descent, because we are most at risk, then that means throwing out the profit. And sometimes you do have to volunteer and do more community-based things to get us to a place where we're not in such of a danger zone. So that's how we, tackle barriers. We are the solution. There's no, great white hope that's going to swoop in and save us, or else it would have been done. So we have to be willing to do it ourselves. And, I feel like whatever we do, eventually others will follow, because they already are, right?
And I also just want to say, Nubia, I like how you mentioned about the solution, that preeclampsia is not a genetic position that should be happening every time, but it brings me into preconceptional health. Like I mentioned, I have 4 daughters and 3 sons and a bunch of grandchildren. And I know as soon as my daughters had their menstrual cycle, I sat them down, explained to them what was going on with their body. They knew before that, but I did it to them again, and we went through our ritual. But I told them specifically what anemia was and what you're losing blood every month. And if you don't eat these foods and drink this way, you're going to wind up anemic. So I'm not bragging, but I want to say that none of my daughters have ever been anemic, and nor have I. And so unless you have sickle cell anemia or the thalassemia trait, we should not be anemic. And there's so many women say, oh, it runs in my family, because as you mentioned, Nubia, it's because we haven't learned about eating. So I know we have food deserts. It's really difficult. People living off, living off ramen noodles because of college, or the mother had to work. And one thing we do when we do our SMC full circle doula training, we sit in a circle and everyone goes around and talk about their food culture. That's also a culture. And where, I had a great mom, but she had to work 2 jobs. So I definitely grew up eating microwave food. Or literally someone said, I grew up eating out of the garbage can, literally. I mean, it brought tears. Someone else, we sat at the table and there was greens and okra and butternut squash. And, we all prayed and we took a walk, it was wonderful. So we all have different experiences, but no matter what we have to have preconceptional health. And that we know now, not just the female, but even the male. The latest study came out that, men's sperm impact the egg for the health of the embryo. So our sons have to eat well. It's not just the female's responsibility to bring forth a healthy child. It does take the sperm and the egg being from healthy sources. And so preconception health in the Black community is something that we don't really talk about anymore. We don't have a rites of passage. In fact, most of our daughters are on the pill and deprived by the time they're 13 because they have such bad cramps. So everybody's on the pill. I know so many girls have been on the pill like half their life and they're just getting off. And so we have a lot of things to do. And one thing that we did in Oregon, we created a high school program called Sister Care. And so high school was to bring the girls in after school and teach them about their period and anemia. And it was kind of like a little baby doula program. They did, we cooked from scratch. We had to measure the food and cook a full meal. They did volunteer services. They did double dutch, all these things we did. But the teenagers, they were hard to work with because they all had boyfriends and they had to have jobs. They're trying to finish their credits. And we even got credit for them to attend the program. So we moved it down to the 7th grade. And there the girls said, my mother didn't even tell me what my period was. They knew nothing still. And so this was only like 10 years ago. So girls still don't know, or bleeding bodies don't know. And we need to go back to some African rites of passage or whatever we're going to call it and teach our children, male and female, how to be healthy before preconception, and also to give them a voice, because we're waiting too late to activate ourselves. Our daughters and sons should be able to say, early in life, doctor, I know my daughter had to go to, she was like 14 and they wanted to go into the GYN room. And we already have to understand that she doesn't go in the room by herself because we weren't going to get the, whatever that PV thing shot was. So they wanted to, and they told me I could wait outside in the room. I'm like, well, first of all, I made the appointment for her and I'm paying the bill and I brought her here. So who are you? And let me see your supervisor. Don't tell me I can't go in. So I teach all of my doulas, don't tell your client, don't have anyone say you can't go with your child in that room. You have the right to be in there. But my daughter already had a voice. She already said that I don't want to be here without my mother. And I know, no, I don't want that done to me, but she's already being educated. So education, besides just the academic, going to a good school, but we need the good home, old fashioned or new fashioned information to empower our children before they conceive.
Thank you, Mama Shafia. I'll say that I think double dutch should be added to every training program. That sounds lovely. What I'll add to the question about barriers to achieving respectful and dignified care. One thing I think is important to know is that we as Black birth workers, Black doulas, I think we've gained a high level of savviness because we are aware of the statistics, we're hyper aware of these things. Especially if you are supporting Black and Brown folks, right? So one of the most common things that I know I practice and is practiced within my circle is preparing clients who have low to no risk during pregnancy and for, or perceived to be for birth, to labor at home for as long as possible, right? And so that there is like, okay, this is one strategy that we're employing to minimize any potential for one, intervention, but also for disrespect and abuse in a setting that, is known for that, right? And however, unfortunately, still, doing that, what's happening is we're still being met with disrespect, abuse, and just dignity being robbed from us. And I'll give you an example. I had a recent client, labored at home, long and strong, got to the hospital, and she was in active labor, really close to having this baby, right? I think she was at 8 centimeters, and she is in full-on labor. And, the question that she's asked, first of all, there's no regard for the fact that she is in active labor and is experiencing pretty intense contractions, and she's being pummeled with questions. And because she is focusing on her experience, she's going within, she's not responding to them right away. And the question she's asked by the folks at the hospital, by the providers at the hospital is, are you high? Are you mentally capable of responding to my questions? And I'm bringing this up because I think it's important for people who may not be attuned to exactly what happens, to give specific examples, because this is something that I know beyond a shadow of a doubt that would not have happened to someone who was white. And I've spoken to white folks about issues similar to this, and often that is the response. Had this person been white, that would not have come out of anyone's mouth. So I name that to say implicit bias, anti-Blackness in these spaces are barriers to achieving respect and dignified care.
I just wanted to add to that, it wasn't until I was in midwifery school that I realized it's not normal to routinely test somebody at every single prenatal visit for drugs in their system. That happened to me when I was pregnant with my first. I thought that was part of routine care. And when I was doing my clinical rotation, I won't name the hospital, but when I was doing my clinical rotation, my preceptors would sometimes ask me to randomly drug test somebody, and they were all people of color. And my pushback was, why? What's your reason for that? And if I'm going to drug test them, I'm going to let them know, or I'm going to ask them for permission to do that, because there's no reason. You're not giving me a concrete reason of why you suspect that, other than their appearance. I'm not, and I know how that feels to have that perpetuated on somebody. So I just want to say that, my oldest is about to be 19, so we're talking 20 years ago, but it's still happening present day.
Yes, it is.
From a holistic point of view, because you all have been touching on a number of different things, families, institutions, practitioners, what are some of the specific ways that you envision and see can be done to be able to move from cultures of disrespect and or just poor birth outcomes to creating a space where there is more sacredness in birth, that the energy in the room is guided by the person who is birthing, where that person is being centered, where people are able to have their preconceptual health, like what needs to be done on a legislative and policy level, what needs to be done with providers, what needs to be done inside of different institutions like hospitals and birthing centers. What are the ways in which you all sort of map and envision us getting there? Carmen sort of talked to this a little bit before when making the connection with capitalism, but I'm curious about what are some of the additional ways that we can arrive at dignified and satisfying birth outcomes.
I want to jump on that first and say that Kimberly Seals Aller is here with us, and I'm so proud and love her so much. She's helped me when I was part of the International Center for Traditional Childbearing. We had to deal with US Mirror and their racism, not accepting the ICTC into the United States education, midwife, whatever, but US Mirror. Sorry about the whatever, but point I'm trying to make, we have Earth that we need to look at this app that we can find out and start talking to each other about where's the best place. I always tell my clients, when you shop, you go to Whole Foods, you don't like that apple, or you go to whatever your store might be in your area, you change stores. And also we should complain, how come there's no apples in the store? So we have to create the monetary drive. And I love the fact that Atlanta is losing so much money right now through boycotting because of that voting thing that the governor did to make voting for Black folks, people of color, difficult. They're losing tons of money and they're having a fit. We ride the bus because we walk for 365 days. We kick their bus like, oh, they don't like us, but we want the money. Let them back on the bus. So we have to drive, as you said, come the economics. Second, I learned a thing from my friend I'm going to share with you, who's a nurse in Alabama. When you have a client in the hospital who's having a hard time, get on the phone and call the main number, she said. Ask for the labor and delivery floor. Ask them to page the attending physicians over the chief, the residents, the interns, and everybody. Say you need to see that person immediately. They have to come in and deal with that. Now, that was new news to me 10 years ago, and I have seen people use it. So those are kind of tips, those inside tips that we can work on. And then we all know we have the Momness Bill 2021. I was able to be on a call here in Oregon a couple of days ago with Congressman Underwood, who explained, I heard of it, didn't have time. I'm super busy like you all. I don't read every single thing. I'm for it. But when she talked about all the different aspects of it, it's a very good bill. And one piece, is an incentive, economic incentive for hospitals that are doing better. So as opposed to takeaway will give you more for a better outcome. So those are some of the things I can think of right away. Call the attending, like go over the doctor, and to be honest, really quick again, I had a client, she had a home birth. She could not get her birth certificate. It's almost 8 months. And by 1 year, if you don't get it, it's even more difficult. So she said, what should I do? I told her to write the president of the Oregon Health Authority. She wrote the president with a complaint, CC'd me, and the person was helping her. She had her paperwork the next one, less than 8 hours. So always go to the president of an institution. We don't have to deal with the manager. We can go to the top. They're responsible. Everybody on this panel is a owner of a business or a company. So if you go to them, they're going to find out what the problem is. Because we don't want complaints. We want to fix it. We want happy customers. We want happy health consumers. So don't be afraid to ask for the president of Brooklyn Hospital, the president of Oregon Health Sciences. It is their job to deal with that calls. And I've done it before. You're going to get someone right away because normally we don't call the president. So when you do, it's like, oh, who is this person? So I just want to put that out there.
I think that this is a multi-strategy approach. So I feel like all of us are going to say X, Y, and Z. But I wanted to just something I've been thinking a lot about is that I would be answering this question a lot different as 25-year-old Carmen versus 35-year-old Carmen. And I say that to say that, like, I see birth workers reacting to the institutional wrongs and injustices, and that every response is merited, right? So I want to say that first, like, no matter what it looks like, it's merited. But what I've been learning from watching the elders is how do we channel that, right? So there are folks who are all about the protest and they have the best lungs on the face of the planet, and they could do that till the cows come home. How do we work together, right, with folks that may not like to be in the front of that line, so that those folks can be at the back of that line. So I think that, like, in some of the like strategy amongst those of us that are doing the moving, starting to like identify, like, that person's good at reforming, and that person's good at building, and that person's good at visioning. And then the other piece is, as a midwife, what I have recognized, at least for the midwifery community, is rectifying history, and telling history as it is. I think that one big obstacle, or something that made me feel disempowered, was the history as we know it of midwifery. But then I began to, especially, thank you, Mama Shafia, for the work that you did in ICTC, going to that conference. I think it was like in 2016, 14, and like seeing the actual timeline of Black midwifery. Like I got to buy it during that conference, and having it in my hands and having like this tangible, like, here we are in this history, and this is actually what happened. And then also I've stepped into teaching midwives that are coming in this history, as we become like grounded in the actual history of American obstetrics and gynecology and how that came to be, and teaching that to midwives and teaching that to birth workers. We're able to see the birth system in the ways that a lot of us are describing it, right? Like, we're describing it from experience, but also having learned this history. And I think that specifically for midwifery has been very whitewashed. And so many of our colleagues who are white midwives don't understand the ways in which midwifery has been transformed, when it came from the grand midwives over to like the 60s with the hippies and all of that. I also feel like that with doulas, there are so many different ways of getting trained into doula work, that at least when I was becoming trained as a doula, it was very clear that we had to learn as much from everywhere possible. And now I'm starting to see more of a trend of wanting to learn everything in one place, and then feeling like you're an expert. And while it's true that you're an expert of your lived experience, a lot of us become more competent birth workers the more practice that we have, right? And so I say that because right now have been seeing a lot of focus on doulas, and now starting to have just as much focus on midwives. And that I want to invite doulas, if you even want to use that word to describe yourself. We could have a whole conversation about the word doula, but this is not the forum for that, right? I want to invite folks that are birth companions and people that are going to births, for the emotional and mental side. I think that as we're tackling this, that how do we become better aligned together and having conversations and working together, midwives and doulas? How are doulas becoming the bridge instead of the solution, from the folks that they have as their clients, and to providers that actually care about them. I've seen doulas do amazing things. And so I think that that's important also, because I have also seen doulas also take their fears and reservations and put them into their clients as well, and also midwives and providers. So I think that like doing that is very important. The racism and dismantling the system piece, that might take some time. We've been at that for a minute, and it doesn't mean to stop, but like for me, that's a specific area, right? Like, who do we already have on our team, and how do we make sure that we're like really gelling well, and understanding these things so that we can move forward.
Yeah.
Yeah.
I-
Oh, you want to go? Go ahead. Go ahead.
Oh, that was so good, Carmen. I really appreciate this idea of rectifying the history of midwifery. And I think that, you know, we have opportunities to do that. Whether or not we are in positions of power to make that happen is another question. But one very clear way of doing that is promoting midwifery as a profession, as one that is, you know, rewarding of a career path within Black and Brown communities. You know, I think that is absolutely one path to creating more, just building up the Black and Brown midwifery workforce. And then in you know, conjunction with that, what we have to do is create safe spaces that are both accessible and respectful to student midwives that are coming up. I've spoken to a lot of Black student midwives who are, you know, I'm happy to be here, but like, this doesn't feel all that great because I'm having a hard time either finding someone who will take me on as their apprentice, or these fees are exorbitant. You know, so systems and policies need to be created to receive this, right? And I think that that's where a lot of the focus needs to be paid. And then the last thing I'll say is that the Momnibus Act is one concrete way that we can at least move the needle a bit, because I think I saw someone in the chat say something that I agree wholeheartedly with. The focus and support of community-led initiatives that are focused on this work needs to be lifted up as well. If the Momnibus Act is passed, funding for community-based organizations and initiatives that are doing this work would become more widely available. Yeah, so I'll leave it at that.
Yeah, I definitely agree. My comment was going to be centered on community spaces that really allow for deep-seated healing. Because if we're talking about, you know, our history, we've never really got a chance to actually sit with that and then heal from that. It's get over it, get past it, that was then. But there are, you know, ancestral repercussions that we still live with. It's not like it just, stops right there. It's part of our cellular DNA. And to be able to change that for the generations going forward and also heal the generations behind us, we have to have these spaces that we create where people can, have multi-level layers of healing. And if we're going to go back to the acronym, which is Claim Your Space, when we create these community spaces, that's what we're essentially doing, right? We're creating these spaces for ourselves. We're creating these spaces for the families that we serve. And, I definitely feel that, we need to have, obviously, more midwives of color. The profession right now in the United States is 95 to 97% white. But, midwifery school was hell for me. It was absolute hell. I would never sit here and be like, oh, it was a breeze. Yes, do it. Yes, do it, but know what you're going to be up against. And I'm so grateful that we're having more options, crop up like Jenny Joseph's school, because we need to educate our own. So I'm of the Black Panther kind of, mindset. Let's not wait for them to come in, create it ourselves. Oh, they're not providing options for us for, where we want to birth. Let's create that. Oh, there are no spaces that center, Black birth education or, feeding your baby. Let's create that. We cannot sit and wait. And especially when, you have conversations with some OBGYNs and they'll still point to, oh, operative birth is not the reason why Black women are dying. Systemic racism is not the reason why they're dying, even though evidence shows that. They're going to point to heart issues. And my question is, well, is it normal for a 20 or 30-year-old to be having a cardiomyopathy? No. But if her heart chakra is damaged and she's never had a chance to heal from that generation to generation, yes, it's going to show up. And when is it going to show up? In her pregnancy, right? So until we get to a place where there are more, Black midwives and Black providers, we do have this big surge of Black birth workers, whatever you want to call yourself. And we need to really come together in these communal spaces that we're creating and cut the hierarchy. That's plantation learn mentality. We need to dismiss that because we all have the same, essential goal, which is better maternal health outcomes. So this whole thing of, where I hear many midwives putting down doulas. I've heard that many times. I hear many doulas, and I've said this before, that will say, oh, this midwife transferred, this mother and, it was completely unnecessary. And then they break down the story. And I'm like, no, that was a legit transfer. Like that person needed to be transferred. So if you don't have that clinical background, you can't speak to that. But that doesn't mean that one person's role is more important than the other. It means that we all need to be on the same page because we're stronger together. And if we're thinking back again to plantation mentality, what's happening right here could never happen. 2 or 3 or more of us gathered in one place, we plotting, right? So, we're not in those stages anymore. And we need to stop allowing ourselves to be divided and come together more because, I keep saying this, we are going to be the solution that we need. Nobody else. It's going to be, from us, from the ground up, grassroots. And I love Mama Shafia's advice, which was, because she shared this with me, go to the top. Why are you starting at the bottom and working your way? We don't have time for that. Go straight to the top. If you have a complaint, you're going to get more momentum that way. And ever since she shared that with me, that has been golden. I've saved so much time in the efforts that I've been putting out there because we don't have time to waste if we're talking about, life and death and really creating viable, spaces for healing for our people.
I just want to say too that, when I became midwife, I had a great time because, there's 13 Black midwives. We just hung together. We ate each other's houses. We watched each other's kids. We would drive to the birth and go meet someplace and, hang out after and discuss the birth. So I know someone just said they're isolated. So I want to say we do have the National Black Midwives Alliance with Jamara, who's a CPM, and Haggie, who's a CNM, one in the South, one in New York. I think it's a great showing of, CPM, certified professional midwives, working with certified nurse midwives, as Black women, that we, or Black people, we can work together and not allow these two different stratas to keep us apart. And like you mentioned, Nubia, about the doula piece, and again, I've trained doulas since for 18 years. We had the first doula training company for Black women in 2002. So we've had our program for 18 years. And I told them from the very beginning that we're here to work with the midwife, and that you're not the midwife, though I'm a midwife. I trained that we're doulas, and so we're limited to what we know. We have to trust the midwife. It's not a be against them. And the same with my Black midwives friend, like, oh, Shafia, you're training midwives? Like, we can't stand them. I had to tell them that we don't need those kind of midwives. There's all kind of trainings, you all, and different trainers tell their students or their adult learners different things. But as we all said together here, um, it is about unity, and each part does work. Like Carmen said, I look at Black Lives Matter. I'm watching the George Floyd case. I'm reading the New York Times. I'm happy what I'm seeing, because white people are out there saying the chief of police, the medical examiner, this was bogus, you all. This was murder. 15 years ago, we would have never seen that. We never saw cops go to jail. 10 years ago, we've been seeing cops. Now it's totally messed up still. But I always say that we want to make sure that we see that we don't let our ancestors' death be in vain. People have died today and yesterday, and will die again tomorrow to get to where we need to be. So, we have to love each other as Black people, and as Black midwives and doulas and birth workers. We have to work together and be able to discuss our differences, and not divide. It's okay if I don't like the way that you wrap your head, or I don't agree that you didn't give the mother cohosh tea because you don't believe in that, and I do. But we still can work together on some level. So I just want to say that we have to find better ways. And the American system is about divide and conquer, even among their own people. The Irish and the English fight forever, and so don't the French. Europeans don't get along, you all. They act like they, but they don't. So we have to not use their model and use our model. And we're unique to be in this country because we're in this country in a different kind of way. So I just want to say, love, patience, forgiveness, uh, use act in the relationship, hold your space, trust your intuition, keep asking like why and figure it out, but agree not to break up the relationship.
If I may add another piece, and I know that we need to move into questions. Thank you for everyone who's been sharing. And something that's also become increasingly clear as I am also watching everything that's happening in the world across cultures as well is that as we move our work forward for racial equity, for me, it's increasingly clear that when I affirm the humanity of people of my clients, that there's it takes on a different like conversation when I'm talking about like their humanity. And that's really important when we're talking about like these policies and like the doctors, the administrations and things that we're looking at systems that are dehumanized and humans trying to access humanized care from dehumanized people in spaces. And that sometimes some of the issues that we talk about can feel really big, and then I think about like my child, and I'm like, how do I explain to my child that she should be nice or that she shouldn't maybe she shouldn't throw something at me, right? And right now she's small, but I know that like I've noticed that she connects with my feelings. And so something that I have seen in hospital spaces sometimes also is that I'll connect with like a nurse that might be a little bit out of line. I'll be like, hold on, let me look at your heart for a second, right? And I know that this might sound like really like all of the things that some of us make fun of, but I really believe that like I have been able to move this conversation forward with like people that are seemingly my enemy, or like that I've been made to see as other, by talking about like human rights and like talking about like the UN Charter of Human Rights, right? Like these things that cannot be refuted or like you cannot argue with the truth of the matter, right? Like we can argue, you want to argue with racism all you want, but you cannot argue with humanity, right? And how we're in a dehumanized system. And so as we're talking to administrators, policy and whatnot, like how do we bring some of that human rights stuff that we don't have in the United States law? Like we actually don't have a way to try people in the United States for violations of human rights. And this entire country is founded on human rights violations up the yin yang, for lack of another word to use it. Therefore, how can we move our work forward in maternal health if we do not profess and proclaim that not only are you violating us racially, but you're violating us on a human rights violation, and that we will continually bring you to charge in front of the UN, in front of like The Hague, right? Like in front of all of these national worldly institutions that we stand as Africans of the descent of the motherland, right? As humans, right? That we reclaim that how much more we can infuse people that might be also dehumanized, that we consider our enemies, that could very potentially start to like understand like this isn't just a black and white thing, right? This is like we're being stripped from all levels. So how do we infuse human rights into these policies, into the training programs, into how they staff our hospitals, and how they're breaking apart our doctors and dehumanizing them to dehumanize us? In the training programs that you're talking about, Nubia, how are they breaking apart the midwives so that they're churning out midwives that are now traumatized and broken? And so I wanted to like, speak to that before we move on to our questions, that we're really talking about not just like dignity for the Black person, but dignity for the human body. And ways to infuse that in all of the things that we're talking about, in all of our interactions and the policies that we're writing.
Absolutely. And I think to go back to something you said earlier, Carmen, it just makes me think about how, a for-profit healthcare system really perpetuates these kinds of things where we have to advocate on our own behalf as consumers when really we need to put the healing back into the healthcare. Or we even have questions if it was even a part of what we know as modern American medicine because of the insidious history of how not only gynecology, but other forms of medicine have come to be. So I'm going to move us into our Q&A part. I see some folks have already dropped in some questions. We also got some questions in advance. So we're going to do our best to answer as many of them as possible. And I want to start with a couple that were brought in advance, see if I might be able to combine them. Someone was talking about inside of a hospital setting. So getting back to like, how do we navigate dignified and satisfying birth experiences and outcomes in all kinds of settings? Someone wants to know, how do we empower folks who are delivering in a hospital setting not to consent to induction of labor? And I think it's connected to this next question, which is sort of a more macro question around how are we creating spaces that are safe outside of the system? Nubia, you were sort of getting at that around like, going back to how the Black Panther Party created their own sort of spaces, grassroots, community-led spaces, but also curious about, so it's two-part question. One, navigating inside of a hospital system, someone speaking specifically to induction of labor and being able to decline that and to not consent. And then also, how do we create safe spaces outside of the system that center sustainability, longevity, and health?
Yeah, I'm happy to speak to the first part of the question, and obviously anybody else jump in too, but I think it goes back to education and the first letter of the acronym, ask questions. And so you understand the reason why. So you're 38 weeks and, oh, we think we're going to induce you next week. Why are we inducing me? Is there a medical reason? Is my baby, at risk? Am I at risk? And there are so many fear things that, oh, we think your baby's too small. The next week we think your baby's too big, and all these things. And there are actual ways to, determine if there's a medical need for an induction or if it's just convenience. And we do want, babies to come when they're ready. We want people to understand physiologic labor. So it goes back to education so that when that is thrown out there, they can come right back with an intelligent answer and ask questions and counter. What is the medical reason for inducing me? If you can give me a medical reason that I need to be induced, then yes, let's have that conversation. But if it's just for your convenience or this is just what your hospital does, no, you don't have to prescribe to that. And I think the more that we can arm people with that factual information during the pregnancy, that when that inevitable conversation comes up, because a lot of times it does, if you're planning to birth in a medical industrial complex, that you are, ready with a response that is not just, oh, I don't want to be induced, but you have a reason behind that.
Yeah, I totally agree, Nubia. I also want to lift up that, in doing that, sometimes it can feel like you against an entire system, right? So to get to a place where, you're ready with your questions and you're not going to back down, that requires an extremely high level of preparedness and resilience also, that some people may or may not possess. So I do want to name that. And at the same time, I want to say that there are systems of support outside of these institutions that I think should be lifted up more. So folks who are at a space where, okay, I'm prepared to counter something that does not feel or sound right. And I'm going to make sure that I have the backup support of my doula. I'm going to, cultivate a space of support around me that consists of people who respect my goals and my desires and are willing to receive the education to understand how I've arrived at this place or already are coming with it. In a previous talk, in preparation for this call, Mama Shafia lifted up that, we shouldn't only center people of reproductive age. We should be looking at our elders as well. It's our grandparents and, older aunties and uncles who also need to be on board with the fact that physiological birth is what we should be striving to, and is in most cases healthy and normal, because this conditioning of the hospital and over medicalization and heavy intervention has long been in the making. I'll give you an example. I had a client recently, 18 years old. No one in this person's family was supportive of her decision or her desire to breastfeed exclusively, and so like that just doesn't come out of anywhere. And it was hard. It's like you feel like you're fighting a really an uphill battle. I'm battling. It's really hard to go to task with grandma, and so if we can have spaces where we are speaking about this and educating in a community setting that is welcoming and safe, I think that would assist us also.
So Nicole, talk about grandmas. I had to do on the breastfeeding. I had to do a presentation. It was all older people. I forget what it was, but I mentioned breastfeeding, and I asked they were Christians. I asked how many were Christian. They all raised their hand. Who would say they were all saved? So I told them, I said, well, Jesus Christ was breastfed. So you're saying that God doesn't know what he's doing, that the breast milk is not healthy? I had like 8 women run over, like, oh my God, I'm so sorry. Is it too late? I need to support my granddaughter in breastfeeding. So you're right. We do need to talk to the grandparents and the elders. And that's one thing that the grand midwife did, and we should be doing. I'm sure we're doing it. We have to do family health. It's not, when we say physiological birth is I understand the concept, but it's limiting. I want to say like family birth or community birth, or the village is all involved, because that way we get the partner, the mother, everybody has to support that person. And I've made many phone calls to family members. I got cussed out a few times, but most of the time I don't. Most of the time I take the time to explain what's happening. I explain about infant mortality, Black babies dying, bring God, whatever they believe, I bring it in, like, what's your belief? We have this comment. And in the end, there'll be, I see change. So we do have to go beyond the pregnant person with their permission and talk to their support people.
I just want to remind that when we're talking about educating the whole family and also, making sure the doula is on board as an advocate and the whole team, that is essentially what ACT is doing. And when we're talking about having the wherewithal when you're actually in the room with that provider to be able to speak up, that's what the workshops, and the practice scenarios and the role playing is about, so that the first time you're asked that question is not, when you have a doctor with that white coat in front of you and you might clam up, but you practice this throughout the pregnancy. Your other family members will practice this too, because you do need everybody to be on board so that you don't feel like you're up against this whole hospital system and the whole medical team, but that everybody in your family is on the same page and is willing to have your back as well.
Thanks for bringing ACT back up.
We have a few folks who are asking about resources and information concerning their midwifery practice, like wanting to learn from elders, want to be able to be inside of programs that support folks with having an ancient holistic knowledge. And I'm curious if you all have any recommendations for folks who are looking to become a midwife or are on the path and are needing additional resources to connect with other Black and POC midwives. Do you all have any suggestions and recommendations around that?
I think I'll just say something briefly, then I'll let you jump in, Carmen. So I would just say that before anybody can answer that question for you, you have to think about what type of, midwife you'd like to be, what type of setting you plan on working in. There are many different pathways, and you have to kind of explore what feels right for you. So, I don't think I could say, oh, here's the perfect program for you, the same way I couldn't tell you who's the best midwife for you, who's the best doula for you. But I think you have to know the different options, and also specific to where you live, perhaps, and the setting that you want to, provide care in. So, I'll let Carmen go ahead and jump in, because maybe she has specific suggestions as well. But I just want to say that you really need to do it first, a deep dive into how does this, what does your unique pathway look like?
Definitely. I had to do that deep dive for myself. That's how I landed on being a CPM. In terms of learning specifically from a Black midwife, the only direction I actually pointed someone in the Q&A to is Jenny Joseph. I know is recently been trying to make her program available and more accessible. And so reaching out to her and seeing where that is at right now. And I think that as we start to see more Black-led birth centers and Black-led education programs, something that really helped me was creating community with other Black and Indigenous and Latinx midwives on the journey. So it might feel daunting to do that. I know some of us may feel like weird about just reaching out to people, but like following accounts on Instagram and calling people, like that's on my midwifery journey. I met Mama Shafia when I was little. not that I'm any older, because definitely deferring to the elder in the room.
It's okay. You're older. They had a birthday.
But really though, like being connected, even if they just like breathe one word of life into you, because we're still, I believe, organizing around these things. Then there's organizations that have started to crop up, like the National Association to Advance Black Birth, and then we've had national Black doula organizations. There you can find membership in different communities, maybe even closer to where you are in the United States. The other options for CPM, at least, are predominantly white institutions. So kind of in the stream of what Nubia said, um, knowing that if you decide that is the route that is only available to you, the PEP process, which is just doing it on your own and like gathering your experience on your own, can be also equally as arduous. But in that event, then connecting to these organizations can help you find potentially a Black preceptor. If you have to go through these organizations, at the very least, trying to make sure that your clinical experience, if you are aiming for the CPM license certification. I can't speak to the CNM. I know that Nubia, you probably have more experience, or the just directly entering. I went through a MEEC accredited education, so I can only speak to that pathway.
I mean, basically, midwifery in this country is a white institution, period. I mean, we know the Shepherd-Town Act, they eradicated the Black midwife in the early 1920s. We've been fighting ever since to reclaim our space, which we're doing. Having been in for a long time. It's wonderful to see so many Black women and people who are entering midwifery, whether it's CNM or C, but we have no Black schools anyway, except for Jenny's. So I would suggest, just like folks have to go to I'm going to say Harvard or Yale, we're still in these spaces. We still live in America. And because they're white, we have the right to go there. We can, until we create our own, we have the right to be there. We're taxpayers. And I would say, like, get in there and just do what you got to do. Just like your grandmother had to be the only Black person to ride the bus. I mean, this is our history. And so we need to remain strong and just get what you want to get what you need to get and move out. And then go ahead and that's what I had to do. I had to go to all these white institutions and do this and do that so that I could later create something that could be a Black space. I am going to say for our training for people who want to be midwives, because a lot of these midwifery schools, maybe except for Jenny, is not going to teach you anything about Black midwifery. And our training is designed to teach about the Black midwifery in our doula training. So when you do leave, you can just say, you know your history. And I did put in the question, the timeline that Carmen spoke about, it's been redone and it's on our website for free. So if you go to shafiamonroe.com, just go to Midwife, you can download it and just print it. So I made it accessible. Anybody who wants it can have it, because I want everyone to know that we have a history. You know, we didn't just start 10 years ago. We started a very long time. We've done amazing things that you would never know. The first Black midwifery school, Tuskegee, the second one, you know, out of Louisiana, you know, there's just so many things. So I just want to put that out there as well.
Thank you, Mama Shafia.
You're welcome.
And thank you, everyone. There are still so many more questions and so much more conversation to get to, but we're moving towards our closing. I encourage you to stick around for a couple more minutes because we have a closing performance. On behalf of BCFSM, I want to thank our esteemed panelists again for generously sharing their time, their expertise, and their experiences today. I would also like to thank all of you, the audience members, for joining us in this space. And before we close, we're going to welcome Sarah Jones back for our closing act.
That was such an amazing panel. And I hope you remember me. My name is Rosali. I'm the one, I'm half Dominican, half Puerto Rican, all proud Black woman. I feel like I want to applaud. I know that this work is going to continue, and I'm so grateful to everybody who participated in this panel. And I want to let y'all know something. First of all, we need to expand doula access for everyone, in case that wasn't clear from the panel. Especially for Black mamas and Black birthing people. And on top of that, doulas still cannot be relied on to fill in the gap of white supremacy, the racism, the disrespect that's in the system as it exists now. So we know that. And I just want to tell y'all something really quick, because it's a lot, it takes a village to raise our community to where we need to be in terms of the health outcomes and just the overall health, community health that we deserve as Black folks. And I wanted to mention that even though Keisha didn't really give him his moment to shine, her partner Jerome was there. And we need to look at how this impacts the entire community, including partners. So what's good, y'all? My name is Jerome. Y'all, I feel like, nobody warned me that we was going to get a little second. I'm emotional. Keisha, that's my heart. Our daughter, watching everything that they went through together, I didn't realize just how deep the situation is right now. So I just want to say, as a male, as a cisgender male, I'm learning how to say all the right things. I'm here for all of this, the whole community benefit when we work together like this. So thank y'all. Thanks, Jerome. And really quickly, as we are moving forward, I also want us to honor the past. So one last word. Hi, y'all. I don't want to take too much time. We're supposed to keep it quick. But my name is Dolores, and I'm probably older than some of y'all all put together, your age combined. But I could tell y'all that Black women, I know y'all say Black birthing people nowadays, we have a tradition, long history of taking care of our own. And I'm so glad to see y'all bringing that into this 21st century and beyond. It really it moved my heart. I was moved by everything I heard. So long before y'all reach my age, I hope you have the satisfaction to feel the community pulling together solutions like this and be able to look at the people standing on your shoulders and be proud. I'm proud of every one of y'all, baby. Thank y'all.
Thank you, everyone. Feel free to direct any additional questions that you have via email. Everyone here is Googleable. You can certainly reach out. Find us on Instagram through all of our tagged handles. Feel free to DM and more. I hope you all have a beautiful rest of your weekend and a great Black Maternal Health Week. See you on the interwebs and maybe in person too.
Thank you, Taja.
Thank you, Taja. Thank you, everyone.
Thank you, everyone. It's good to see
Thank
everybody.
you. Yes.